Hello everyone, myself Trupleta Sahu, second year MSc Nursing student from College of Nursing Bhimsar Bulla. As a part of my dissertation, I would like to do a video assisted teaching program on knowledge regarding cardiopulmonary resuscitation among undergraduate students. Today I am going to talk about cardiopulmonary resuscitation, or it's otherwise known as CPR. Cardiopulmonary resuscitation or CPR consists of three parts. Cardio means heart, pulmonary means lungs, and resuscitate means revive or restart. So, cardiopulmonary resuscitation means reviving the heart and lungs. CPR is a technique used in an emergency when a person's heart has stopped beating and their breathing has stopped. Now we will look into the heart. Not this one, human heart. Human heart is a muscular organ about the size of a fist. It is located just behind and slightly left of the breastbone named sternum. About 2/3 of the heart mass is found on the left side of the body and the other 1/3 is on the right side of the body. The heart pumps blood through the arteries and veins called blood vessels. The vessels that bring blood to the heart called veins, while the vessels that carry away the blood from the heart towards the region of the body called arteries. The human heart pumps blood throughout the body via circulatory system, supplying oxygen and nutrients to the tissues and removing carbon dioxide and waste materials. The heart consists of 4 chambers. 2 chambers are the upper portion called atrium, which consist of right and left atrium, while the 2 chambers at lower portion called ventricles, which consist of right and left ventricles. Now we will look into the human lungs. Lungs are 2 spongy cone-shaped organs lying in your chest. The left lung is divided into 2 lobes and the right lung divided into 3 lobes. When you breathe in, air goes into the lung tissue called alveoli. Where gases exchange occur means oxygen present in the inhaled air passes into the blood and carbon dioxide came out of the blood, and when you exhale, it came out of the body. So now we will learn how heart and lungs functions. Right atrium receives deoxygenated blood from the veins and pumps it to the right ventricle. The right ventricle then sends it to the lungs where it is loaded with oxygen. As the blood gets oxygenated, the left atrium receives oxygenated blood from the lungs and pumps it to the left ventricle. The left ventricle pumps the oxygen-rich blood to the rest of the body. The normal blood pressure of a healthy human is 120/80 mmHg. Now we will understand what is CPR or cardiopulmonary resuscitation and its implication. Cardiopulmonary resuscitation is a life-threatening emergency situation, facilitate blood circulation and breathing until further medical measures are taken. CPR is generally only effective if performed within 4 minutes of stoppage of blood flow, or it will lead to irreversible brain damage. So it should be performed immediately on any person who has become unconscious and is found to be pulseless. The initial assessment for an unconscious patient using Dr. ABC, where D stands for danger, R stands for response, A stands for airway, B stands for breathing, and C stands for circulation. When you see a casualty, first go check for any danger to make sure it's safe for you to approach them. You don't want to become a casualty yourself. Remove watch or jewelry that can make hurdles while giving CPR. Then as you approach, introduce yourself, ask them questions, try to get a response. If they are not alert, do not respond to your voice, then kneel down beside them and gently shake their shoulders. You can pinch their earlobes to see if they respond to the pain. After checking response, shout for help if the patient is unresponsive. Then open the airway by putting one hand on the forehead and gently tilting the head back with two fingers under the chin to check any airway obstruction. Check to see if breathing normally. We do this by placing our ear and cheek over their nose and mouth, looking down to the body, see if their chest rise and fall. We do this for 10 seconds. The normal range is 12 to 18 breaths per minute. If the casualty is not breathing normally, call 112 or 102 or put the phone on the speaker or ask anyone to call and explain the victim's condition to the ambulance service. Then check for carotid pulse. Place your index and middle finger on your neck to the side of your windpipe. Check for maximum 10 seconds. If there is pulse, then only give respiration. If there is no pulse, then start CPR immediately. The normal pulse rate is 60 to 100 beats per minute. Remember, if the casualty is unresponsive and breathing normally, then give recovery position that I will show you later. And if the casualty is unresponsive and not breathing normally, then immediately start CPR. CPR comprises of 3 steps, that is chest compression, airway and breathing. For lay rescuer, compression only CPR is recommended. CPR is most easily and effectively performed by laying the patient supine on a relatively hard surface which allows effective compression of the sternum. The CPR provider places the heel of one hand on the patient's sternum and other hand on the top of the first finger interlaced. Extend the elbows and provider leans directly over the patient. Press down, compressing the chest at least 2 inches or 5 cm. Release the chest and allow it to recoil completely. The compression depth for adults should be at least 2 inches. The compression rate should be at least 100 to 120 compressions per minute. The key phrase for chest compression is push hard and push fast. Untrained bystanders should perform chest compression only CPR. If the patient is not breathing, 2 ventilations are given via the provider's mouth. To perform the mouth, pinch the patient's nostrils. Put the mouth completely over the patient's mouth. After 30 chest compression, give 2 breaths. Give each breath for approximately 1 second with enough force to make the patient's chest rise. After giving 2 breaths, resume the CPR cycle. When one-man adult CPR is being performed, maximum 10 seconds should be the duration for checking the breathing of the victim. After giving 5 cycles of CPR, check the carotid pulse. If there is no pulse, then again start CPR till the medical help arrives. Let's see what happens when we take our hands off the chest. Blood stops moving to the brain. It is for this reason that you are taking off your hands from the chest while switching roles. It is critical to minimize the time of the chest. Watch what happens when we don't push deep enough. Blood does not reach the brain. The same is true if we does not push fast enough. Watch what happens when we push too fast. The heart does not have the time to refill the blood, therefore not enough blood gets pumped out. Watch what happens when we don't allow the body to decompress and allow the chest to fully recoil. The heart does not have a chance to refill the blood, therefore no blood gets pumped out. So remember, the key purpose of delivering compression is to keep oxygenated blood moving within the heart and up to the brain to keep the brain alive. We need to push hard and push fast. When one rescuer present for a child or an infant, the CPR ratio will be 30 compressions to 2 breaths. When 2 rescuers present, then the CPR ratio will be 30:2 for adult and 15:2 for child and infant. The 2 rescuers should switch every 2 minutes. The CPR technique used for infants are 2-finger method or 2-thumb encircling hand technique, and for child it's with one or two hands at lower half of the breastbone called sternum. In an emergency condition, the crucial part is to maintain the chain of survival. The chain of survival refers to the chain of events that must occur in rapid succession to maximize the chances of survival from sudden cardiac arrest. It consists of 4 key steps, that is, early recognition and activation of the emergency response system, early CPR, rapid defibrillation, and advanced cardiac life support. When you see signs of the victim regaining consciousness such as breathing, coughing, or moving purposefully, stop CPR and put the victim in a recovery position. To put the victim in a recovery position, firstly lean on the floor by the side of the casualty. Angrily arm the casualty by taking the arm and position it in a right angle and palm facing upward. Bring the other hand and place them under the cheek as shown in the video and hold the hand properly. Now fold the farthest knee and place the foot on the floor. Now pull the knee off the folded leg. Ensure the airway is open and recheck the breathing. We should not perform CPR on any victim if the victim is severely burned, amputated due to road traffic accident with heavily bleeding, or spine fracture.
One and two and three and four and five and one and two and three, 4 and 10 and 1 and 2 and 3 and 4 and 50 and 1 and 2 and 3 and 4 and 20 and 1 and 2 and 3, 4 and 20, but 1 and 2 and 3, 4 and 30. 2 blows. One cycle. 1 and 2 and 3 and 4 and 5 and 1 and 2 and 3 and 4 and 10, 1 and 2 and 3 and 4 and 15, 1 and 2 and 3 and 4 and 20, 1 and 2 and 3 and 4 and 25, 1 and 2 and 3 and 4 and 30. One and 2 and 3 and 4 and 5 and 1 and 2 and 3 and 4 and 10 and 1 and 2 and 3 and 4 and 15, 1 and 2 and 3 and 4 and 20, 1 and 2 and 3 and 4 and 25, 1 and 2 and 3 and 4 and 30. Three cycles. 1 and 2 and 3 and 4 and 5 and 1 and 2 and 3 and 4 and 10, 1 and 2 and 3 and 4 and 15, 1 and 2 and 3 and 4 and 20, 1 and 2 and 3 and 4 and 25, 1 and 2 and 3 and 4, 30. Four cycles. 1 and 2 and 3 and 4 and 5, 1 and 2, 3 and 4 and 10, 1 and 2 and 3, 4 and 20, 1 and 2 and 3, 4 and 20, 1 and 2 and 3 and 4 and 25, and 1 and 2 and 3 and 4 and 30. Check for pulse. Pulse present. Check for breathing. Breathing present.